It was 2011. We were three friends sitting on the steps of a church in southern India, discussing how we could give back to the world. This is when the idea of establishing a registered nonprofit was born. From there, we recruited 4 additional friends to formally establish a nonprofit membership association in Germany. We named ourselves Friends for International TB Relief, as friendship and community are at the core of our endeavor. To start our work, we drafted a constitution with the vision of dedicating our efforts and resources to a world free of TB. Just 1 year later, in 2012, the 7 friends formally inaugurated FIT through a meeting in our home country of Germany. Our intent was to raise awareness and funds in high-resource countries while providing technical and financial support in high-burden TB settings. Since this meeting, our commitment has taken many forms around the world, from hosting educational events in Germany to providing technical assistance in India, and then expanding to direct service delivery in Vietnam. At the time of our founding, we never expected that we would achieve all that we have, but we are proud to have come this far in just 10 years and are truly grateful to all FIT members in Germany, teammates in Vietnam, and supporters around the world. Immediately after our association was formed, FIT started supporting local TB care and prevention efforts in India through the provision of organizational management and financial technical assistance to a local NGO. In 2013, we made a major organizational decision to focus our energy and resources on TB in Vietnam. We asked friends and family of the association founders for donations and ultimately raised $14,000 to fund our first pilot project in Ho Chi Minh City. We teamed up with the Ho Chi Minh City Public Health Association and launched the Proper Care pilot project in 3 of Govap District's 16 wards in early 2014. Our goal was to increase treatment coverage and improve the TB treatment success rate. The pilot was a success. We sent emails to numerous potential funders, hoping to expand the scale of the pilot. We were fortunate to receive a small grant that allowed us to double the size of our pilot project so that it covered half of the wards in Govap District. By the end of the year, we had received another small grant, which expanded the pilot to all wards of the district. With this growth, FIT members began engaging with the Zero TB initiative. This association helped us to better focus our approach for TB elimination. We aim to employ a multifaceted strategy where we actively search for people with TB and those exposed to TB outside of health facilities. Use fast and accurate diagnostic tests. Start treatment as soon as possible with the correct medicines. Use shorter duration and less toxic medicines, which are easier for patients to ingest. Support patients throughout their TB treatment to manage their side effects, mitigate loss of income, reduce out-of-pocket costs, and ensure treatment completion. Prevent people from being exposed to TB. Treat people who have been exposed to TB so they do not become sick. Integrate sustainably. Fully integrate into the existing National TB Control Program services. Co-create programs with local partners. During these formative years, FIT established several critical partnerships, which resulted in the awarding of grant funds for multiple new projects. The Proper Care pilot expansion, Proper Care in the private sector, known as PCPS, the Impact TB Operational Research Study, and the NTP's Zero TB Vietnam project. 2017 was a year of exponential growth. We expanded community-based TB case-finding activities to 8 districts of Ho Chi Minh City. And with our new funding, we transitioned our programs to 100% electronic data capture and reporting, registered as an international NGO in Vietnam, hired over 20 staff, supported over 150 community healthcare workers, and moved FIT members to Hanoi to maintain consistent engagement with the NTP. So many of the reasons why I decided to join FIT at the beginning of 2017 for this large scale up of activities was that it aligned with my passion to fight TB. So TB is really a bully disease. It attacks the most vulnerable people who have comorbidities or are at the poverty line, and it goes for them and makes their lives very difficult. So I really want to eliminate this bully disease, and I felt that the people at FIT were committed to put in the level of attention, the level of detail, and the resources needed to fight this disease holistically.
Vậy là đã được 5 năm tôi có một quyết định đúng đắn khi rời bỏ môi trường nhà nước để tìm đến một tổ chức hoàn toàn mới như là một tổ chức phi chính phủ, cùng là trong lĩnh vực y tế, nhưng mà công việc trước đây của tôi là chỉ dừng lại ở cấp độ bệnh viện, nhưng với công việc tại vị trí mới này tôi được làm quen hơn nhiều với công việc ở cộng đồng. Điều này đã mang lại cho tôi những trải nghiệm vô cùng thú vị, đặc biệt là tôi có thêm kiến thức về bệnh lao và những cái gánh nặng mà bệnh nhân lao, những cái gánh nặng dành cho bệnh nhân lao, cho gia đình của họ và cho xã hội. Tôi đến thời điểm này tôi cũng rất tự hào khi đã là một thành viên của tổ chức FIT, và tôi sẽ luôn hy vọng là mình sẽ được tiếp tục bước cùng tổ chức FIT. Tôi rất tự hào khi làm việc ở đây.
In 2018 and 2019, we grew our operations within and outside of Ho Chi Minh City to include areas of Hanoi, Haiphong, Hoi An, and Can Tho. We began using mobile X-ray trucks to screen people in the community in both urban areas as well as islands and mountainous border provinces.
In Hanoi, Haiphong, and Hoi An, we were starting from scratch without an office really. I recall traveling to Haiphong and Hoi An every week, meeting with partners and trying to get them to know who we were and what type of work we were doing. And although the scale was quite small at first, everybody was supportive. I recall the flood season in 2018 where I almost hopped on a boat to travel to the district health center. But everybody was there, the leadership was there, and everybody was supportive. The community healthcare workers were very happy to learn about the project procedures, but also how to use the tablets and things like that. It was truly a very exciting time.
In May 2017, I first joined FIT when organization started the project named Purple Care in the private sector, as known as PCPS. We do the pilot in 2 districts in Ho Chi Minh City. At the beginning, we faced a lot of difficulties and obstacles when working with health facilities here because they didn't know who we were and what we did. So we took a lot of time and efforts to convince them, to ask them to cooperate with us, and we had a very successful process. And after that, we expanded to another 19 districts in 3 cities, including Hanoi and Haiphong in 2019. And again, we had a very successful project. In 2021, we received the package of Global Fund via NTP, the project PPA Model 5 in 5 central cities in Vietnam, including Da Nang in Can Tho, Mekong Delta. And then in 2022, this year, we expanded to another 5 provinces.
Tôi nghĩ tôi thực sự là một người may mắn bởi vì không phải ai cũng lựa chọn được một công việc ý nghĩa và phù hợp như tôi. Làm việc tại FIT, tôi tìm thấy sự đam mê, niềm tin trong một môi trường làm việc đầy cống hiến của các đồng nghiệp. Với công việc này, chúng tôi đã giúp đỡ được rất là nhiều người nghèo khổ, cũng như là những người tại những hải đảo, miền núi xa xôi hay là những vùng biên giới. Và họ rất là khó tiếp cận với những dịch vụ y tế. Vì vậy tôi nghĩ trong thời gian tới chúng tôi cũng sẽ cố gắng hơn nữa, thật nhiều nữa để có thể giúp đỡ được nhiều người, đặc biệt là những người mà yếu thế và nghèo khổ.
As our programs grew and were optimized, we began to conduct evaluations on their impact and effectiveness. Our staff began presenting these findings at international conferences, and in our first 10 years, we have published 15 peer-reviewed scientific articles on diverse topics, such as active TB case finding, TB in the private healthcare sector, TB diagnostics, treatment support and social protection, health economics, TB in vulnerable populations, and TB infection testing and preventative therapies.
I'm really proud of the research work that we've done at FIT. It really has the potential to make TB care more patient-friendly and to accelerate declines in TB in Vietnam. A lot of our staff are early career researchers who had the opportunity, for their very first opportunity, to present at conferences or to publish because of the work we've been doing at FIT. And now many of them have leveraged their experiences and have graduated into a master's degree, PhD, and medical training programs, or even working with donor agencies.
In 2020, the country of Vietnam managed to successfully contain the COVID-19 pandemic, and our operations were only minimally affected. By the beginning of 2021, we had grown to over 100 staff working across 18 provinces. However, in the second half of 2021, our operations were severely disrupted for the first time during the COVID-19 pandemic. After a strict lockdown, we changed all of our programs to address the new implementation challenges, including delivering TB medicines to the homes of patients who were in isolation. It became impossible for us to assemble mass gatherings of people for TB screening in the community due to social distancing restrictions. So we began using handheld x-rays to screen people for TB when they came to COVID-19 vaccine campaign events that were conducted by the government. Now that we begin 2022, we are pausing to reflect on our struggles and achievements over our first decade of operations. This is an opportunity for us to make plans for the next 10 years.
So the last 10 years have been an incredible journey, and I hope that for the next 10 years we can build upon what we've already accomplished. And in doing so, I hope that we can take this organization beyond our successes and achievements, beyond TB, for example, where we expand into other public health areas or other relevant service areas that are needed for overall development of lower and middle income countries. Beyond project implementation, into more research, more knowledge generation, and even perhaps more policy making. Beyond Vietnam, into some of our neighboring countries, perhaps Cambodia, the Philippines, or even beyond the Asian region into perhaps Africa and other parts of the world where it is needed. And lastly, perhaps even beyond the non-profit, the traditional non-profit mandate, leveraging more of our social enterprise model where we can perhaps try to generate our own income that can then be used to cross-subsidize some of our philanthropic objectives. So overall, in summary, we hope that we can build upon what we've achieved over the last 10 years to use the next 10 to go beyond what we've already done.